A related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, everybody. Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency, and we are servicing Miami, Broward, and Palm Beach County. And you can reach us directly at 954-717-7027. I am your host, Louise Gomez. And today I would like to introduce everybody to we have Dr. Osama Al-Alao. He is the director of the Kidney Stone Center. He is a urologist and a kidney stone expert right here at the Cleveland Clinic. The website is clevelandclinic.org. And I believe someone else, Dr. Todd Schroeder, is also joining him as well. So welcome to the show.
Thank you. Thank you.
We appreciate you taking time out of your busy schedule to come on the show, and so we can educate our listeners a little bit more about what you do. So thank you, Dr. Schroeder and Dr. Al-Alao. We appreciate you. And I did not get your phone number. Is there a number that we can give out if somebody wants to contact you directly? What would that number be?
Yeah, sure. So I'm going to give it to you at the end. It's going to be the main phone number for the same call center for Cleveland Clinic. And through that phone number, you can reach out to all the doctors at Cleveland Clinic, Weston, Tradition, Stewart, Vero Beach. We have a centralized system here.
Oh, perfect.
So, yeah.
Okay. And so please, if you can both introduce yourselves and just describe a little bit more about your specialty and what you do, I would appreciate that.
I'm Dr. Osama Al-Alao. I'm a urologist based at Tradition Hospital, Cleveland Clinic. I'm specialized in the treatment and prevention of kidney stones. And with me, Dr. Schroeder, I will let Dr. Schroeder introduce himself. He has been here for many years, and he was a great help for our work here at Tradition Hospital in the field of kidney stones and many other fields.
Thank you. Yeah, so thanks for having us. I'm Dr. Todd Schroeder. So I'm an interventional radiologist, and I work with Dr. Alao. Interventional radiologists work with many other specialties. We do procedures based on using radiology guidance, which of course fits right into the treatment of stones. With Dr. Lau and with many other specialties.
Oh, wonderful. So how common are kidney stones? That I'm curious to know. How common are they for us?
Well, believe it or not, 1 in 10 or 1 out of 10 people will have an episode of kidney stone in their lives. And then 50% of those will have another episode within 5 years, unless we, for sure, just help them with to prevent that, which is something we can offer and focus here at the Kidney Stone Center of Excellence.
I'm curious, doctors, is this more common in males or females, or there's no discrimination?
No, actually, I don't think there's any research showed the difference in between genders.
Okay. And Is there a common theme maybe that you see with patients? Is it anything to do with diet or lifestyle, or can you kind of give us maybe some patterns that we as we'd like to educate ourselves on maybe how we can prevent these naturally. So maybe you can give us some patterns that you see within that realm.
Yeah, that's a great question. We the purpose of the Kidney Stone Center of Excellence is not only treatment for kidney stones. It's mostly about prevention, and there are so many factors. Some of them because of Florida, where we live here, and some of them is based on each patient. So there are so many patterns that we can talk about in details, and it's not always one size fits all. It's like it's
Sure.
case by case based. So every patient has a unique case, and through tests and through thorough examination and history taking, we can always find out why. And I would like to maybe later on give you lots of examples and scenarios and how we successfully impacted the life of many patients we have here at our center and prevented them from having episodes of kidney stones.
What about the chance of reoccurrence? Once somebody has kidney stones, does that make them be a candidate to have reoccurrence, or how does that work?
Yep, it's a 50% chance of getting another episode within 5 years. Yeah, it is a very it's a very high recurrence disease, and that's why prevention is the key to help these patients to avoid all the complications of missing work, the
Right.
pain they're going through, and this is how like picking up the stone early with the help of radiology, because the most accurate way to find out if you have a stone or not is just a simple X-ray or a CAT scan, or that's done on a regular basis now when any patient comes to the emergency here. So picking up the disease early and treating it early and help with prevention is one of the keys. Yeah.
So if somebody goes to the clinic and they're presenting with pain and you do the radiology and they do indeed have the stones, what would be the next step? What are some ways that you are able to disintegrate those, or what does that next step look like?
So most of the time, patients don't wait to show up in the clinic with pain. I think they end up either in urgent care or emergency, because unfortunately the stone pain is really severe. It's too much, and I think when they come to the emergency, Dr. Schroeder maybe can talk about the different modalities we offer at Cleveland Clinic for picking up a stone, maybe like the differences.
Yeah, sure. So lots of times nowadays, people will come into the ER and they'll have some non-specific pain, maybe flank pain, maybe lower abdominal pain or pelvic pain, and it's just really common to get a CT. That's kind of the study of choice nowadays. So you'll get a CT of the abdomen pelvis. Not really sure what we're going to find. It may be that they have appendicitis, or maybe they have a stone. But we pick up a lot of these stones nowadays. And from the CT, you get so much information. You can find out the size of the stone, whether it's a large stone or maybe a small stone. And that may really impact how Dr. Lau is going to treat it. We can find out if it's caused an infection just by looking at the CT. We can find out if it's caused obstruction, whether the kidney is obstructed or the urine is obstructed, if they're both obstructed. So we get all this information from the CT. Other times they may get an ultrasound. Sometimes patients just get an ultrasound, particularly if they have like right upper quadrant pain and they're concerned is it a gallbladder, and then we'll incidentally find that actually it's a stone. So those are kind of the maybe the screening studies. And then once Dr. Lau is involved and we know there's a stone, if there's more information that's needed, we may go on to like a study that tells us more about the function. So we may do a renogram study with nuclear medicine. So that would be done maybe at a later basis. And that'll tell us, is the kidney working? Is the kidney obstruction causing the kidney to fail? And then that'll also, tell Dr. Lau really the emergency of the procedure. Does he need to do something faster, or can just something wait longer and be scheduled as an outpatient for a visit, with her?
It sounds very painful, and from what I've heard from several people in my life, I've heard that it is a very painful experience. My question to you is, before that excruciating pain, are there any telltale signs that somebody would maybe think, oh, I might be getting kidney stones? Is there anything preliminary before the excruciating pain?
That's a great question. I never had that question before, but now I'm like, I think the most important thing to predict if you're going to have a kidney stone is genetic factors, because it's always genetic and hereditary in the family.
Oh, yeah.
Means like if you have someone in your family that has a kidney stone, a father or mother, there's a very high chance, unfortunately, of having a kidney stone. The other thing that I don't think really there's something that can predict if you're going to have a kidney stone, because I can talk more about the physiology, why this stone happened. And after that, I would like to ask Dr. Schroeder about something came up to my mind now. What do you prefer to? Because I had a patient today is asking me, I was like, I want to avoid a CAT scan because it has radiation. So maybe can I just do an ultrasound? Maybe you can elaborate more, because most of the patients now are very informative, and they're very well educated because of the great access to information through internet. So they always challenge me with very nice questions, and I was like, let me ask Dr. Schroeder.
Dr. Google. I always say they talk to Dr. Google first, right? And then.
Okay, so I have my own opinion about that. Most doctors tell patients don't go to Google. I love when patients read, because I like when patients are more educated and more informed, and they come up with more questions to know about themselves. Sure. Really, every patient is different. I've been working now for 15 to 20 years in stones procedures. I've never seen a patient where two patients the same, because every patient has their own background, and that's why they make stones. There's always every patient. There's never two patients where they're the same. Going back to your question about what factors that can a patient predict that they're going to have stone, I think genetic and hereditary is the most common one. Otherwise, unfortunately, when you have pain, the kidneys are next to the bowels. It's they're all the same area. So if you have really severe pain, the first thing I advise always patients, when you have pain, please go back to your primary care. We have great network here of PCPs, primary care physicians at Cleveland Clinic, covering the area from Fort Pierce to Tradition to Port St. Lucie to Stewart, down to West Palm Beach, and along, of course, to Weston. So we have a great electronic medical record system. So when you go and see a primary care, they're just going to go through all the background and see if this is going to be a stone or maybe just a back pain or something else.
Sure.
Yeah. So,
Dr. Alao, we have a quick commercial break. We'll be right back. Hold that thought. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you, everybody. We are speaking with Dr. Osama Al-Alao as well as Dr. Todd Schroeder, and they are at the Kidney Stone Center. Actually, Dr. Alao is the director of the Kidney Stone Center, and they're at the Cleveland Clinic. Please check out the website, www.clevelandclinic.org. There are many locations within the South Florida area, so you are able to do some research and see where you can go. But thank you for coming back on the show, doctors. We appreciate that. And I'm trying to remember what we were discussing. I think we were talking about, I know you said it's genetic, so that's good to know that at least we have an idea that if maybe our parents had it or somebody in our family, that it's something that we should be, on the lookout for, right?
Yeah, so
Go ahead.
go ahead.
No, go ahead.
I don't know. The genetic factor is an important cause, but also most patients have factors related to the location where they live. There are more incidents of kidney stones for patients who live in the southern part of the U.S., like in Florida or Arizona or Texas, compared to the northern part. And then also if they have other reason related to their diet and related to the other organs in their body. So humans, we're like not just we're all, yeah, exactly. So it's like every organ is connected to the other organs. So I actually did my training in different places. I worked in Dubai and
Nice.
I worked in Europe, and I worked in the US. And it was very interesting to see that every place has its own cause of causing kidney stones. And when I was working in New York, for example, there was other reasons, like patients love to drink seltzers and other drinks that cause. Here, it's mostly the dehydration. So
Interesting.
And the beautiful thing about medicine these days that it's really advancing so fast every day, and we can get more and more information. I never had to do surgeries, or I never had the privilege to do surgeries for patients who are 90 to 100 years old. Now, like this today, I did 7 surgeries now just before this interview. 2 of my
Wow.
patients are 95 years old, and they're fine. They're great. And these
Amazing.
patients have different reasons for having kidney stones than the young patients. So it's beautiful when we can not only use the top tier modern technology in treating stones, we can also have sources to tell us why these patients are making stones and prevent them from happening again. I'm gonna tell you more about what we offer here at Kidney Stone Center of Excellence. But yeah, I'll leave it back to you.
Just really quickly before we get into what you offer there, I had a quick question because you've practiced medicine in so many different places. Does the United States have a higher incidence of kidney stones? Do you find that?
No,
No, not necessarily.
it is mostly in hot places. So
Wow.
when I worked in Dubai and in Doha, it was very similar incidents to places like Texas, and it's it is related to the hot weather.
Interesting. I
No,
did
no,
not know that.
it's higher. The incidence is higher in places in hot weather. So you can say that in Florida, it's very
Sure.
similar incidence to places like Dubai or some hot places in Africa or in Asia.
Well, we better make sure we stay hydrated, if anything, from what I'm hearing. This is important. But yeah, please tell us about how you treat these stones. We're so curious to know. I know you have so many different modalities. Please share with us some of those.
So now we have the privileges, the privilege of using the most modern technology now here at Cleveland Clinic. It's all based on how we can visualize the stone and how we can uh, treat it, take it out with the least invasive option, the least painful option. That's the most important
I
thing
like
for
that.
yes, yeah. So how medicine in general is just going every day towards less invasive, less painful, and less traumatic. So it depends where the stone is. I think Dr. Schuler was saying before that it depends on the presentation of the stone, but there are the stone, if it's if it's in the kidney, we can offer something called extracorporeal shockwave lithotripsy or lithotripsy, which is sound waves used from outside, non-invasive, to break the stone.
Oh,
We,
good.
yeah, this is I think this has been there for many years, and it has advanced a lot now. And some places they can even offer it to as an outpatient. As an outpatient way to break
Okay.
this.
Nice.
The other option is the ureteroscopy and laser lithotripsy, which is just going through the urinary tract without having any skin incision and just break the stone, blast it with laser, and take the stone out.
Okay.
The third option we offer is to go from a very small incision, tiny from the back to the kidney, and this is where Dr. Twitter helps me with his
Yeah.
team. We have a great team of four interventional urologists: Dr. Isaacson, Dr. Duncan, and Dr. Frank Garcia. They maybe you can elaborate more about this technique. And before
Yeah.
he starts, since I started here like almost a year and a half ago, we did 50 cases so far, and this is a very
Nice.
complicated, difficult case. We exceeded the national average of in terms of like complications and outcome. Zero
Yes.
complications, perfect
Wow.
outcome, and the patients are either very old or like
Yeah.
paraplegic or obese. Very good outcome. So, but 50% of the work is for Dr. Schroeder.
You know,
Yeah,
I
so
can't believe we actually have 1 minute left, so we have to kind of wrap it up. But please tell us in the last minute what all that you do, how you work as a team, and what else you do to help people alleviate from or get rid of these kidney stones. So we got that 1 minute left, so let's go.
Well,
that was it.
yeah. So the team is really big. We start with the radiologists and interventional radiologists we have in the team. We have help from nutritionists, dietitians,
Nice.
nephrologists, infectious disease, endocrinologists, general surgeons, and ENT. Because believe it or not, if there is a problem with the parathyroid gland, that might be a very main cause for kidney stone formation.
Oh,
So I think our team involves like up to 100 different healthcare workers between doctors, nurses, and we're available. We were like either available in offices for office visits or over the phone for questions over my chart and to reach us through electronically. And I'll give you the phone number whenever you're ready for it.
Yeah, we're ready for the phone number because there are people in our audience listening and they know somebody who wants to get in touch with you. So please give us the phone number.
So it's going to be the main call center number, and you can just ask for kidney stone consultation. The number is going to be 877
Uh-huh.
463 2010.
Thank you so much, both of you, for taking time out of your schedule. We really learned a lot. Anybody right now, anybody in our audience, if you know of anybody, any friends or family, we have our experts right here. Please give them a call. Thank you so much, Dr. Schroeder, Dr. Al-Alao. I appreciate both of you, and maybe we'll have you back on again another time to discuss it a little more. Thank you.
Great. Yeah, I'd love to.
Take
Thank you.
care. Great interview. Bye.